The Equine Care Clinic by Amanda Edwards provides expert levels of care, management and training to horse owners for sick and injured horses. With a background spanning over 25 years in nursing, critical emergency response and intensive care on humans and working in a range of institutions, as well as years of experience in handling horses, Amanda brings forth a great deal of knowledge to sick horse management. Amanda's work with horses is also a valuable asset to veterinary guidelines and prescriptions being carried out for sick or injured horses.
You know, something about there is pretty good.
So what you'll often see is that people will just walk up to the horse, they'll have it standing with its head up, and they'll just go bang, 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 whack it in, heads up into a tight muscle. Yep. Oh yeah, okay. Now, if the horse's head's lower, the muscles are connected all the way from the back of the tongue right to the back legs, like right down to those back hocks. All of these muscles are connected. So if he's up like this, all of his muscles are taut and it's going to hurt more. So you're injecting into a hard muscle. So what you want, as she says, is get that muscle, that
Nice
leg
and
underneath
relaxed.
him, bring
See
that
how soft it is
slightly towards you. So a little bit this way and lower.
And when we get inside and further discuss the theory behind giving this sort of medication, we'll talk about the use of heat packs, cool packs, things like that, general massage, anything to that extent can help the process. If you've got, because often when horses do have to get like IM medication, intramuscular medication such as penicillin, it can be over a course of weeks. So it's a lot of needlework and it's
A lot of needlework.
so it can get a bit painful. So this is the most comfortable for him, and it'll prove to have the most longevity with, you know, if you've got to do it a few times.
It keeps the site soft.
So if he was to, usually I do this on my own, Mum and I do this on our own, but if he was to start playing up when I was to give the injection and running around, I'd work him. And then if he was scared of this, like he wouldn't let a needle come. A lot of horses are very shy of needles.
the minute you touch them on the neck with the needle, they scoot off. So
I'd get the needle and I would just gently wait. I'd work him around and then I'd bring the needle, just the capped needle, and I'd just put some pressure
see,
there.
in fact, he's got a reaction to that. So what we want to do is hold that pressure on and then just say, no, keep your head down low. And the minute he's there, which is now, you take it away and you give him a rub.
So, and if he was to do it, and I'd do this over and over and over again, preferably when he's not actually injured. So if you know you're, like we train all our horses when we get them. Like Sunday is newer, and she was trained pretty much when straight away we had a clinic with her. And she was trained to have bandages on and to have needles and to have, you know, I immediately tetanus and strangles. She had a vaccination just to see where she was at needle phobia wise. She was wormed straight away. So these are all good things to practice before the event that your horse gets injured. Not saying that.
Do you want to show where the needle sites are?
Yeah. Basically your needle sites are it's too big, but more like that. So,
oh look, you've got a dirty line. Perfect. So see where this crest is here, and then up to about here, and inside that square. It's not very big because what you've got here is the nuchal ligament. So there's ligaments up here, there's nerves around there. You've got artery, vein. And down here, you've got more vascular tissue, so you're more likely to hit a vessel down there, and that's got problems. So you stay in this area. You can also go.
You can do rump area. Depends kind of. This is a very hard muscle.
And that's what they do.
He knows.
They can kick you. He's never actually. Don't think had injections. He's just a bit probably it's a really, really hard muscle.
It's very hard to inject into. You can also inject if you draw a line down from here and a line from the tail across to here. All right. Oh good, thanks. There's your X. I was holding him. Oh, he likes. He's going to give us the tail. So where the two intersections happen, that's not quite so hard. And it's a big muscle to hold into.
It's really, but it's a dangerous, so you kind of got to really know your horse.
So next preference.
Yeah, next preference for us is the pecs. So we don't, often fluid can build up there. So we will do generally we'll do one on this side, one on that side, one on this side, one on that side, a pec.
Yep.
And then
And a pec.
again, go back to the neck.
So 2 days of, because you do usually morning and night.
Oh, so morning, night.
Morning, night, morning, night, morning, night. Then the third day, morning, night, back here. So, and if we're having to do it, usually it's a 5-day course. So they'll cope with, you can usually get away with the neck on that, on a decent sized horse. But if it's weeks, then we always ice pack. And it's nice, I think, anyway, just to ice pack them after you've done the injection.
And
Heat pack them prior.
Okay.
Just to soothe that muscle.
So, because I don't know if anyone's had a penicillin injection.
Nope.
It's kind of painful.
It's like getting like liquid metal.
Oh, is it?
It's not that bad.
It's thick.
And the tetanus has got a bit of a kick to it as well.
Yeah, you guys had a golf ball outside of her arm.
But again, when you leave your injection, so you take your injection out, most people just walk off.
Yeah.
Give them a little, rub, massage it, whatever. Will you stop that?
Should we go?
Yes, we're going to do medications.